Conjunctivitis, commonly known as pink eye, is an inflammation or infection of the conjunctiva, the thin, transparent layer of tissue that lines the inside of the eyelid and covers the white part of the eye sclera. This condition causes the eye to appear red or pink due to blood vessels in the conjunctiva becoming inflamed. Conjunctivitis can affect one or both eyes and is highly contagious in its infectious forms. Types of conjunctivitis. There are several types of conjunctivitis, each caused by different factors. 1. Viral conjunctivitis caused by viruses, most commonly adenoviruses, often associated with cold, flu, or upper respiratory infections. Highly contagious, spreading through contact with eye secretions or respiratory droplets. Symptoms include watery discharge, redness, itchiness, and sensitivity to light. Usually self-limiting, resolving on its own in about 1 to 2 weeks. 2. Bacterial conjunctivitis caused by bacteria, such as Staphylococcus aureus, Streptococcus pneumoniae, or Haemophilus influenza. Highly contagious and can't spread through direct contact with infected individuals or contaminated surfaces. Symptoms include thick yellow or green discharge which can cause the eyelids to stick together, especially after sleep, redness, and swelling. Requires treatment with antibiotic eye drops or ointments. 3. Allergic conjunctivitis triggered by allergens, such as pollen, dust mites, pet dander, or mold. Not contagious. Symptoms include itchy eyes, redness, tearing, and swelling. Often occurs in both eyes and may be seasonal hay fever or year-round chronic allergies. Treated with antihistamines, eye drops, and avoiding allergens. 4. Irritant chemical conjunctivitis caused by exposure to irritants, such as chlorine in swimming pools, smoke, fumes, or chemical splashes. Symptoms include redness, watering, pain, and a burning sensation. Not contagious. Treatment involves flushing the eyes with water and avoiding further exposure to the irritant. Severe cases may require medical attention. Symptoms of conjunctivitis. Regardless of the type, the most common symptoms of conjunctivitis include redness in one or both eyes, itchiness or irritation in the affected eyes, tearing or watery discharge, more common with viral and allergic conjunctivitis, thick discharge that can form a crust on the eyelashes, more common with bacterial conjunctivitis, swelling of the eyelids, sensitivity to light, photophobia, foreign body sensation, feeling like something is in the eye. Causes and risk factors. The causes of conjunctivitis vary based on the type. Viral, caused by viruses like adenovirus, which also cause the common cold. It can spread through coughing, sneezing, or touching contaminated surfaces. Bacterial, caused by bacteria such as Staphylococcus, Streptococcus, or Haemophilus species. It spreads easily through contact with infected hands, objects, or eye secretions. Allergic, triggered by exposure to allergens like pollen, dust, or pet dander. It is often associated with other allergic conditions like hay fever. Chemical/irritant, caused by exposure to irritating substances like smoke, chlorine, or cleaning chemicals. Risk factors for conjunctivitis include close contact with infected individuals in schools, daycare, or work settings. Allergies or exposure to allergens. Swimming in contaminated water for chemical conjunctivitis. Use of contact lenses, particularly if they are not properly cleaned or worn for extended periods. Diagnosis of conjunctivitis is typically based on a physical examination and the patient's history of symptoms. Healthcare provider will examine the eyes and ask about exposure to potential allergens, irritants, or infected individuals. In some cases, the sample of discharge from the eye may be taken and analyzed to determine whether the infection is viral, bacterial, or allergic. This can help guide treatment, particularly if symptoms are severe or not responding to standard therapies. Treatment for conjunctivitis depends on the underlying cause. 1. Viral conjunctivitis. There is no specific treatment for viral conjunctivitis. It is usually self-limiting and clears up within 1 to 2 weeks. Symptom relief may include applying cool compresses and using lubricating eye drops, artificial tears to soothe discomfort. Avoiding the spread. Practice good hygiene, such as washing hands frequently and avoiding touching the eyes. 2. Bacterial conjunctivitis treated with antibiotic eye drops or ointments, which typically resolve the infection within 3 to 5 days. Hygiene measures are essential to prevent spreading the infection to others. Symptoms should begin to improve after 24 to 48 hours of starting antibiotics, though the full course should be completed to ensure the infection is fully cleared. 3. Allergic conjunctivitis managed with antihistamine eye drops, oral antihistamines, or anti-inflammatory eye drops such as corticosteroids in severe cases. Avoiding allergens is key to preventing symptoms. This might include staying indoors during high pollen seasons, using air purifiers, or washing bedding regularly. Cold compresses can help soothe itchy, swollen eyes. 4. Chemical/irritant conjunctivitis. The first step is to flush the eyes with water immediately to remove the irritant. Depending on the severity of the irritation, additional treatment may include lubricating eye drops or, in severe cases, medical treatment from an eye specialist. Prevention to reduce the risk of developing or spreading conjunctivitis. Follow these preventive measures. Wash hands frequently with soap and water. Avoid touching your eyes, especially with unwashed hands. Don't share personal items like towels, washcloths, makeup, or eye drops. If you wear contact lenses, follow proper hygiene practices, including washing your hands before handling lenses and cleaning them as directed. Stay home from work, school, or daycare if you have viral or bacterial conjunctivitis until symptoms resolve, to prevent spreading the infection. Keep surfaces clean, especially in communal areas, to prevent the spread of infection. When to see a doctor. You should seek medical attention if symptoms don't improve within a few days or worsen despite treatment. You experience severe pain, blurred vision, or sensitivity to light. There is intense redness or swelling, or you notice a large amount of discharge. Newborns show signs of conjunctivitis, as this could indicate a serious infection. In cases of bacterial conjunctivitis, Prompt treatment with antibiotics can prevent complications such as corneal ulcers or vision impairment. Conclusion: conjunctivitis, or pink eye, is a common and often mild condition that can cause significant discomfort. While viral and bacterial forms are highly contagious, allergic and irritant conjunctivitis are not. Treatment depends on the underlying cause, and good hygiene practices are essential to prevent the spread of infection. Most cases of conjunctivitis resolve with appropriate care, though severe or prolonged symptoms may require medical attention.